Good day, I'm Theodore Henry, and this is your JIS News for Friday, April 11, 2025. Work is now set to start on the Barrett Hall housing development, which will deliver another 1,500 dwellings for the people of St. James. Prime Minister Dr. Andrew Holness broke ground on the development yesterday. It represents a partnership between the National Housing Trust and building company Wicon under the NHT's Developers Program. Through this program, developers build on land owned by the NHT with an agreement to sell 80% of those units to the housing agency at an affordable cost. A mix of detached 1- and 2-bedroom units as well as service lots will be offered at Barrett Hall, and Prime Minister Holness says 60% of them must be available to the lowest income earners among NHT contributors.
That is not just a clause in a contract. It is a commitment to the working class families who keep this country going. The teachers, police officers, farmers, hospitality workers in particular, the tourism workers, who I'm sure will be eyeing this development very keenly. We are building for you. Indeed, we are building for all Jamaicans.
During the ceremony, Dr. Holness revealed that the NHT was providing an additional 20% in mobilization funds to partners in the Developers Program and 15% to those under the Guaranteed Purchase Program. This is expected to ease the cash flow burden on developers and reduce delays.
Developers have told us that while the NHT's 5% mobilization advance is useful, it often doesn't go far enough, especially given that civil infrastructure can account for up to 25% of project costs. And that is why we are revising the financing framework for both the developers and the Guaranteed Purchasers Program.
Meanwhile, Prime Minister Dr. Andrew Holness is assuring investors that the government is building a strong labor force that will help to grow their business. He was giving the keynote address at the opening of the 5th staging of Outsourced to Jamaica 2025 in Montego Bay on Thursday. The Prime Minister says the government has made workforce development and digital skills training a priority. This is to influence and shape the future of work with laborers who are innovative, creative, and add value to the knowledge pool. Dr. Holness asserts that labor must not be a constraint for economic growth.
The strategy and policy of the Jamaican government is to empower our local labor force. In this regard, the work of our national training agency, the Heart Trust NSTA, the Global Services Skills Council, and our digital literacy and skills programs have been instrumental in creating a steady pipeline of talent, not only for traditional outsourcing, but for fintech, cybersecurity, software engineering, and data analytics. We are investing heavily in skills development.
All employees of the National Solid Waste Management Authority, NSWMA, will have full pension benefits by the end of the calendar year. That's the word from the agency's executive director, Audley Gordon.
It's one thing to have nice offices. It's another thing to have good wages. But what about when you get old and can't work anymore? I am to report this morning that we have met with Sagicor. We have arrived at certain decisions with them, but we didn't want to go too fast ahead of ourselves. We met with a core team of people from across the regions, the 4 regions in Ocho-Rios, and we settled on certain things.
He also made the point that several contract workers of the agency have been made permanent staff members as part of a broader government policy decision.
NSWMA is among the first entity to be reporting this morning that nearly 2,000 people already I signed permanent letters for them across Jamaica, taking them out of this uncertainty of contract work to where they can plan their life now and they can make life-changing decisions financially because they know where the bread coming from once they go to work and do their work.
Mr. Gordon was addressing the official opening of WPM Waste Management Limited's new building in Ironshore, St. James on Tuesday. Jamaica is strengthening and expanding its partnerships with India and the Philippines to improve healthcare delivery. Earlier this week, a communique was signed with the University of the Philippines, Manila, to fill human resource gaps in specialized areas such as oncology, pediatrics, and critical care. This follows on a memorandum of understanding signed in Jamaica by the two countries in January.
What we have conceptualized and we are developing is a sustainable model of working together, the Philippines and Jamaica, to expand faculty, to train trainers who are Jamaicans, and of course to provide an opportunity to train more Jamaicans in the specialized nursing areas in the first instance. Hopefully it can expand over time.
The Health and Wellness Minister gave the update on Tuesday as he participated in the 7th Global Ministerial Summit on Patient Safety in the Philippines. Dr. Tufton is now in India with a team from the ministry engaged in talks with Indian officials to cement an agreement on the development of human resources and the provision of affordable drugs.
We discussed a range of things, including the completion of a memorandum of understanding, discussions that started between Prime Minister Modi and Prime Minister Holness here in India, later on further discussions with the Caribbean. The MOU will see a number of issues around health that we will collaborate on, including drugs and access to drugs, but also very importantly around human resource development and the collaboration around training, both training our healthcare workers in specialized areas, or the nurses in particular.
This partnership will provide access to Indian healthcare workers temporarily to fill gaps left by Jamaicans that have migrated, while the local health workforce is being trained and developed. Still on health, the ministry is urging Jamaican travelers to get vaccinated against yellow fever, as it notes an increase in human cases in countries of the Americas region this year. The Pan American Health Organization and World Health Organization have reported increased cases in Bolivia, Brazil, Colombia, and Peru. While it continues to undertake surveillance at the ports of entry, the ministry says it is important for Jamaican travelers to get vaccinated and show proof of their yellow fever vaccination when traveling to and from affected countries. The vaccine should be administered at least 10 days prior to travel. Yellow fever vaccinations are administered at the Slipen Road Comprehensive Health Center in Kingston and the Montego Bay Type 5 Health Center in St. James for a cost of $1,500. Yellow fever is an acute illness caused by the virus of the same name, mainly found in the tropics of South America and Africa. It is transmitted by the bite of infected mosquitoes such as the Aedes, the same vector that transmits the chikungunya, dengue, and Zika viruses. And that's it for JIS News today. I'm Theodore Henry. Thanks for watching.